The latest data suggests that coronavirus rates and hospitalisations are reducing in London. This is crucial to the recovery of our city and means Londoners and visitors can get out and about to enjoy all that our capital has to offer. As we do so, everyone should continue to take common sense steps to protect themselves, their loved ones and their communities from COVID-19, particularly people who are most vulnerable to serious infection. This means avoiding contact with others if you have flu-like or COVID-19 symptoms, continuing to wear face coverings in enclosed spaces such as on the transport network, maintaining good hand hygiene and letting in fresh air when meeting people indoors. Similarly, the government should be maintaining a robust testing and surveillance system to ensure fast action can be taken to protect our communities and reduce avoidable pressures on the NHS. I was deeply concerned to see reports of significant cuts to the UK Health Security Agency, which will greatly diminish our ability to identify, prevent and respond to current and future public health interests, something my health advisor, Dr. Tom Coffey, has raised in a letter to the Deputy Chief Medical Officer. It's also important that testing remains available and free to those who need it, so I was disappointed that the government ended free testing in April. Testing is especially important for clinically vulnerable Londoners, people in vulnerable settings and people in inclusion health groups such as people who are homeless. We also know that the best defence against COVID-19 is being fully vaccinated. Londoners aged 75 and over, those in care homes and those with weakened immune systems are now eligible for a spring COVID booster, and the vaccination programme was recently expanded to 5 to 15-year-olds. It's never too late to come forward for vaccination, whether it's a booster or a first dose, and I encourage all Londoners to book their vaccinations to protect themselves and others against COVID-19. As we move forward and learn to live with COVID, we must remain vigilant and flexible. This includes not being afraid to act swiftly to bring in measures in the future should they be needed.
Thank you very much, Mr. Mayor. And I'm going to pick up first on what you said about the need for robust testing and surveillance and your disappointment that the free testing has been ended. Now, your Strategic Co-ordination Group, the SCG, did great work throughout the worst of the pandemic, helping Londoners to access vaccines, food banks and opening up appropriate channels of advice and support, and doing really excellent work, kind of making sure that the boroughs were really effectively joined up and working together well. Now, right now, London is facing a new crisis, the cost of living crisis. And if you wanted to buy a lateral flow test, you can get them for about £2 a test at pharmacies. But this is expensive for people who want to be responsible and test regularly, or people who aren't covered by free tests. So if someone's got a chronic condition or lives with someone who does, they shouldn't be financially penalised just because they're trying to take care of their relative. Now, I'm wondering if there's a new procurement role for the SCG in making sure that affordable lateral flow tests are available to Londoners who need them but can't afford to pay that £2 for each test. And I just wondered, yes, if you see any role for the SCG in working with the boroughs, trying to make more affordable tests available so that people can be responsible.
Well, Chair, the role of the SCG is for strategic control from the centre, but the suggestion, I think, from the member is a sensible one. Use procurement power to try and reduce the cost. And the councils actually know who these families are who don't quite satisfy the safety net that the GPs can provide. And so can I take that away, Chair, in relation to what we could do, just thinking together, not just the contacts we've got with the communities, those who may miss out, but also procurement power. Without making promises, I think it's a cracking idea. I'll take it away. I'm more than happy to keep the member updated with progress made in conversations with colleagues in the SCG.
Thank you. That's hugely appreciated, and I look forward to continuing to discuss that going forwards. I also wanted to think about what else we can do to protect people who are clinically extremely vulnerable, and also the NHS workforce. And I wanted to ask if you agree with Chris Hopson, the Chief Exec of NHS Providers, who said recently that we should bring back social distancing and masks. Now, I was wondering what would trigger a change that would cause you to upgrade your recommendation to wear a mask on TfL services to a requirement?
So I don't agree with that suggestion. I mean, non-pharmaceutical interventions, NPIs, are something we looked at and we look at all the time. The advice from OHID was that we followed the government's advice, and we made the one tweak in relation to advising people on transport for London where you can't keep a distance to wear your face coverings. At the moment, the numbers, as I've said, no complacency, always being vigilant, look good. What happens is we meet regularly with public health experts in HOHID, and if there are any concerns they've got in relation to the monitoring they're doing, they keep an eye on a number of surveys taking place which tell us a more accurate number of what the numbers of people with COVID is. The obvious numbers I saw as recently as yesterday was the R number, admissions in hospital, the number of deaths, those in ICU, the various surveys. No reason at all to even contemplate NPIs. But as I said in answer to the main question, I think both the government, OHID, UCSHA and ourselves keep this under review. But at this stage, I'm not of the view that we should change the current advice.
Okay, I suppose the issue is with waning immunity and, you know, the potential then for people who have been vaccinated to end up being hospitalised. It's a question of making sure that we're looking at all those factors that you just raised, so that we know at what point we need to increase the instruction around mask wearing on trains. I think what I'm really worried about is that the reduced mask wearing on public transport is effectively shutting some Londoners out of everyday life. So I was contacted just this morning by a constituent who's back in the office for the first time since 2020 and was actually dismayed and upset by the lack of mask wearing on a relatively crowded underground train that they were travelling on. Now, it is an accessibility and an equality issue. So we've seen this sort of rollback of lots of the health measures in the UK and across the world, but masks are still mandatory on public transport in places like Belgium, Germany and Portugal, as well as some of the cities you visited just recently, like Los Angeles, San Francisco and New York. So I just wonder, you know, without masks, how we can protect all Londoners and inspire confidence also in our visitors who are coming for culture rather than coronavirus.
One of the things we do know is not only is the R number down, the number of cases down, so forth, but also once the government removed the national requirement for wearing face coverings, even though we had a requirement in TfL, the people wearing a face mask reduced hugely because we couldn't enforce the wearing of face masks, which makes it more difficult later on if we decide to bring back these rules for there to be enforcement, because people assume nobody's following the rules, why should I? So later on, if we need to, we can't do so. So, as I said in answer to my previous question, both the government and ourselves, but also the experts, UCSHA and OHID, are keeping this under review. At the moment, nobody's advising us to change the advice on public transport. But as I said in answer to my question, where you can't keep your social distance, the advice is to wear a face covering for the reasons you've suggested, so we can ensure everyone's got access to public transport, which is transport for all of the public, including those who have immunity that is suppressed. And I just ask people to, you know, be aware there may be people around you who may be suppressed, have immunity that's suppressed, but also you may have the virus and not realise you've got it, because, you know, 1 out of 3 of those who have this virus don't show symptoms.
Indeed, indeed. Thank you, Mr. Mayor. I have no further questions, but I do hope that people do keep wearing their masks on public transport, because it does help people, more people, to access everyday life.